The floor is yours. Please share your perspective and experience. I'm waiting forward to your presentation.
Hi everyone. Just gonna share here the presentation real quick.
Yes, it's coming. We see it perfectly. Thank you.
Awesome. Thank you. Okay. Hi, good morning, everyone. To everyone present today, thank you for joining this session. My name is Luisa Leal, and I'm the founder of the Akari Foundation. And I'm here today to talk to you about the importance of diversity, equity, and inclusion in advocacy groups and its effects in patients' access of rare diseases and the Hispanic community. On our summary, we're going to speak about what is diversity, equity, and inclusion, DEI for short, the purpose of advocacy groups, AG, and how the integration of DIA and advocacy groups benefits the rare disease community, improving patients' access through the DIE, and AG in the conclusion of the presentation. For us to be able to have a talk around this topic, we first need to define what is diversity, equity, and inclusion. The community of rare diseases has had some concerns over the years about the equity, diversity, and inclusion, especially considering that health inconsistencies has been seen and experienced. Therefore, it is necessary for us to understand the concepts of diversity, equity, and inclusion. In a brief summary, diversity, equity, and inclusion, DIE. Diversity is the presence of different and multiple characteristics that make up individual and collective identities, including race, gender, age, religion, sexual orientation, ethnicity, national origin, socioeconomic status, language, and physical ability. Equity is the process of identifying and removing the barriers that create disparities in the access to resources and means, and the achievements of fair treatment of equal opportunities to thrive. Inclusion is created environments in which any individual or group can feel welcome, respected, supported, and valued to participate fully. I think sometimes I speak too fast. Let me know if I go too fast. So to put it in simple words, diversity is all the different colors and characteristics that make us unique and ourselves, our diversity in gender, ethnicity, color, socioeconomic backgrounds, etc. As for equity, we're talking about all of us having access to the same resources or opportunities. So to as an example, we could say me and all you have the same chance to, let's say, access to health treatments for whatever disease we have, just as easily and with the same fair treatment, considering each of our individual needs and peculiarities. I'm sorry. Inclusion, on the other hand, considers that all our voices have the same importance in different areas. And as the words say it, it includes every single one of them. We have to remember one thing before we go any further. Let's not confuse the meaning of equity and equality. Let's use an example for this image. Equality means, as an example, we all have free access to public health system. Equality, on the other hand, means the public health system considers each and every one of the barriers we might encounter as diverse of these individuals to make the process as fair as easy for everyone. So if someone suffers from a disability, which will make it harder for them to go up and down the stairs to enter the buildings and go to other appointments, the hospital will have specific infrastructures that will make that access available for those individuals, such ramps, closer parking lots, assistance with the medical equipment, and so on. So like on this picture mentions, equality means giving everyone the same thing, whereas equity means giving people what they need to reach their best health. For example, in the picture below, 3 people of different heights are trying to reach the fruit of the tree. In this case, the fruit symbolizes good health. The different heights of the people represents the unequal distribution of the social determinants of health in society. If we treat these people equally, we will give everyone the same box to stand on, so only the tallest person could reach the fruit. If we treat them equitably, we will give them as many boxes as they need to reach the fruit. With all that in mind, how does this intervene with patient advocacy groups? Patient advocacy groups are organizations that promote the needs and priorities of patients. This could include supporting research for a specific disease, promoting awareness of a disease, and educating the community about a disease, among other activities. Most patient advocacy groups represent one or a few specific diseases. Patient advocacy groups can be powerful and pivotal allies, helping to shape decisions about clinical trials, or even what sort of drugs to attempt to develop in the first place. In our case, the Akari Foundation, our mission is to educate, empower, and advocate the Hispanic immigrant community, help with resources, advocacy, education in rare diseases, specializing in Duchenne muscular dystrophy. We help the community in United States, Mexico, and Latin America. Diversity, equity, and inclusion advocacy groups. I'm sorry. If we approach rare diseases, which is our area of expertise, the topic and relevance of DIE becomes bigger since the rare disease community is already a minority by itself, with a variety of needs and many underserved and underrepresented communities within such a Hispanic community. We know that patients with rare diseases face significant disparities in diagnosis and research. Health disparities with RDs exacerbate these injustices since marginalized communities are frequently underrepresented in research and clinical trials and face additional challenges to getting clinical care. Some examples of these disparities, as seen of the slide, can be sex of gender, race, ethnicity, socioeconomic status, disability, mental health, immigrant status, etc. In order to support patients who are marginalized in this community, rare disease nonprofit organizations must overcome barriers to disparities, this is why we implementing the DII principles within our work is essential. How the integration of DII in advocacy groups benefits the rare community. With the integration of DII in advocacy groups, especially for the Hispanic community in our case, I would set as fair starting point to everyone to have a proper access to fulfill their needs and acknowledge their rights as human beings, especially in the sphere of rare diseases where families encounter many gaps in care. It will also allow us to reach and help more people who need it by offering the same opportunities and the same access for assistance considering their specific circumstances. Accepting diversity in different areas opens a wide range of opportunities for people with different ethnic backgrounds. This will allow them to be heard and to have access to materials, contents, devices, considering their language, disabilities, income, and specific needs. Now, with all this being said, how could this affect, or in this case, improve and benefit patients' access? Let's remember what patient access is. Patient access refers to the accessibility of medical services and patients' capacity to receive care and treatment. When as a patient advocacy group find the proper resources to guide our patients and provide them with programs to fulfill some of their gaps in care and education, by implementing diversity, equity, and inclusion measures in any other aspects such as healthcare, for any community, not just our own. We have realized people not only have better environment where they feel welcome and do get access to the same treatments or resources. They also feel they can approach that specific place without hesitation or fear of not understanding whatever is being conveyed to them, which we know is a huge barrier in our Hispanic community. In conclusion, I have attended several conferences and meetings, and I'm surprised to hear the majority of the leaders of these companies and other organizations are just now paying attention to diversity, equity, and inclusion. What I have heard is that majority was just trying to be diverse. Some believe that as long as they hire according to EEO, they will be okay. EEO stands for Equal Opportunity Employer, the law that requires an employer to agree not to discriminate against any employee or job applicant because of race, color, religion, national origin, sex, physical or mental disability, or age. In conclusion, the more we speak and educate the community about diversity, equity, and inclusion, the more we can help our rare disease community. And this is all about education at all levels, from families to companies, etc. If you need help with this topic within your organization, please feel free to contact us and our amazing team can help you. This is me on your left and Susana, my amazing assistant. We're able to help in any way. And just reference and thank you for your attention.
Thank you, Luisa. You are doing terrific things there. Congratulations, and yeah, it's really spectacular. Can you share with us what was the biggest problem you've met during your activities?
For the organization?
Yes, yes.
Our main challenge is for companies to pay attention to us. We cannot speak politics, but thanks to the previous administration speaking bad about Hispanic community, a lot of companies are paying attention to us now. And it's bringing attention to the needs of our community, not just the Hispanic community, but the rare disease community in general. Our work is just barely starting. You know, we been able to get invited to a lot of these conferences, and that is what is helping us to put our work out there, not just about the Akari Foundation and the work we do for our community, but just our families in general, Hispanic communities and rare disease community in general.
And who is your main supporter? Are the patients, is the community overall, farm industry, regulators, other people involved in non-governmental sector?
All of the above. All of the above. We have had, I've been surprisingly getting a lot of support from the pharmaceutical company. And I say surprisingly because I was one of those persons that didn't believe the pharmaceutical will do something for the community. You know, you heard all these things on the news, you know, pharma is bad. They just want money, 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 you know, but, you're mute. But, I have found amazing people working for the pharma industry. And this is personal to a lot of them. You know, majority of the people who deal with the community that work for the pharmaceutical company, they're in this to help the community. I get along a lot with this person that she works for a pharmaceutical, and I said, hey, you need to come and work with us. And she said, I will do more on this side, helping you and supporting you than with you there, you know, with in your a nonprofit. And I was like, you know, that's right. I have like I said, a lot of support from the pharmaceutical company.
Great. This is nice to hear, because having all stakeholders working together for the common good of patients, nevertheless, being rare disease patients, cancer patients, or people with other conditions, this is the formula for success. So I believe you're on the right track, and I wish you all the good and success with all you're doing. You're doing great things there.
Thank you.
Thank you once again.